The regulatory pathway is prolactin is the only one which has an inhibitory regulation, which is by dopamine. The regulatory pathway accounts for spontaneous prolactin hypersecretion that occurs on pituitary stalk section, right? When we cut the stalk, there is no inhibitory action, so there will be hypersecretion. So that happens in cases of head trauma or compressive mass lesions at the skull base. Pituitary dopamine 2 D2 receptor mediate the inhibition of prolactin synthesis and secretion. Okay, D2 receptor. Targeted disruption gene knockout of murin D2 receptor in mice resulted in hyperprolactinemia and lactoproliferation. As discussed below, dopamine, that is why dopamine agonist play a central role in management of hyperprolactinemic disorders. फिर TRH जो है thyrotropic releasing hormone is a hypothalamic tripeptide which elicits the PRL release within 15 to 30 minutes after IV injection. So TRH जो है, it regulates TSH also and that of prolactin also. ठीक है, so the releasing hormone is TRH and inhibitory hormone is dopamine. For VIP, vasoactive intestinal peptide, it also induces PRL release. So two releasing are there. TRH as well as VIP is releasing, whereas glucocorticoid and thyroid hormone weakly suppress the prolactin secretion. Main suppressor is dopamine. Always remember inhibitory hormone, and glucocorticoid and thyroid hormone weakly suppress the prolactin. Releasing hormone is TRH and VIP. Serum prolactin level rise transiently after exercise, meal, sexual intercourse, minor surgical procedure, general anesthesia, chest wall injury, acute myocardial infarction. Okay, basically release transiently after stress, meals and sexual intercourse is what I remember is important. Minor surgical procedure, general anesthesia, acute myocardial infarction. Okay. Prolactin levels are increased markedly during pregnancy, of course, and decline rapidly within 2 weeks of parturition. If breastfeeding is initiated, the basal prolactin levels remain elevated. Suckling stimulates the transient reflex increase in prolactin level, which lasts for about 30 to 45 minutes. Breast suckling activates the afferent neural pathway in the hypothalamus that induce the prolactin release. With time, suckling induced response diminish and interfering prolactin level comes to normal.